According to the Uganda Virus Research Institute, Uganda has one of the highest global burdens of malaria cases, with over 90% of the population at risk. Malaria remains Uganda's leading cause of death, especially among children. The disease causes immense detrimental health effects and is responsible for 30 to 50% of outpatient visits and 15 to 20% of hospital admissions. The average economic loss in Uganda due to malaria annually is over $500 million. In 2024, the World Health Organization reported an estimated 13.2 million malaria cases and over 16,204 estimated deaths in the country.
Talk about these figures, we are talking about lives lost and a lot of opportunities.
Not only that, malaria is believed to be the leading cause of premature births.
Which we have for malaria remains children and women. And every year we have almost over 200,000 premature births in this country, and the greatest cause of it is actually remains what? Malaria. Those children who are born before the date when they are due is because of what? So, and they are also the ones which are contributing premature deliveries. Actually, they are contributing to the failure of Ministry of Health completely to reduce the neonatal mortality. So you see, though it has reduced, it has stagnated over many years.
Despite the government of Uganda's efforts to combat the deadly disease, including signing of the Rwanda Declaration in the African Union, partnerships, awareness raising, and applying preventive measures, efforts to kill the virus have been hindered.
Worth to note is that Uganda became the first of the 11 high malaria burden countries to implement the resolutions of the Rwanda Declaration to develop a malaria mortality reduction strategy, a strategic roadmap towards ending malaria death. We need to walk the talk by tracking progress, funding our strategies, and building the local capacity.
Further fight this, the National Medical Stores, through the Ministry of Health, has flagged off the distribution of insecticide-treated mosquito nets, marking the initial phase of the 2026 mosquito net campaign, covering 20 districts across the country. This aims to strengthen Uganda's fight against malaria.
We will be taking these nets straight to the parishes and would expect that the districts and the other leaders within the sub-counties and the parishes will help the ministry to deliver these mosquito nets to the Ugandans most in need.
Moses Kamabere, General Manager of National Medical Stores, says that despite the busy campaign activities, NMS, together with parish leaders, will help in the distribution of these nets.
We believe that we will not have to wait for the political campaigns to end before we can protect the Ugandans from these mosquitoes. These nets are to protect the wananchi, and we believe that the Electoral Commission, among the things they outlaw, does not include the distribution of medicines and other commodities to Ugandans.
Minister for Health, Jane Ruth Acheng, appreciated the NMS effort in ensuring distribution of these nets.
Allow me to appreciate the National Medical Stores for ensuring that the nets are delivered to the districts on time and also in very good conditions. And also to appreciate the districts for preparing to distribute the nets during this campaign season.
However, the population has been advised to utilize these nets effectively.
The appeal is for the entire population that it is both our responsibility, especially in ensuring that these nets are put to the right use. In the past, we've had, and we know that at times they have been abused and put to different uses, but it's important that they are put to the right use so that we can prevent malaria and continue on the road to elimination and hopefully eradication.